It's really nice to see everybody. We're going to get started, folks. It's so nice to see a full house of friends, colleagues, and students. I'd like to welcome you to our Psychology Department's 16th Annual Mental Health Program. My name is Nick Shizis, and I'm one of the co-hosts for today's program. I'd like to thank Professor Kara Williams for her hard work in helping us organize and co-host our event this year and almost every year. And thank you to the Psychology Department for their continued support. Thank you also to our theater staff for offering us this beautiful space today. 16 years ago, we started with like 50 students in the library, and it kind of grew into the M building, and then we outgrew the M building, and this is the first year that we're hosting it in the theater. So this is really, really nice. And I want to thank you all for being here. This is really, really wonderful, and I'm touched today. We also cannot host these programs without the support of our dean, Dr. Kiana Battle. Dr. Battle, we thank you for helping us bring this event on campus every year. And finally, thank you to our presenter, Dr. Shenay Bridges-Carter, for accepting our invitation to be this year's speaker. Actually, I have one final thank you to go out to our friend and colleague, Shania Gray. I know I saw Shania somewhere. Shania, thank you for connecting us with Dr. Carter and for always being supportive of everything that we do at our college. And how can we not thank all of you? How could I forget that? How can I not thank everybody here for filling up our auditorium? Again, we really appreciate it. Our program is going to take about an hour and 15 minutes, and at the end of Dr. Bridges-Carter's talk, we're going to ask you to write a question down on one of the note cards. So some of our Psych Club students, maybe some of the professors, myself, will hand you a card if you have a question for Dr. Bridges-Carter, and we're going to collect those, and then we'll ask them to our speaker during our Q&A portion at the end. Now, every year, we try to feature a different topic of mental health. And this year's program is going to address racial and ethnic trauma, which has affected many individuals at our college and in the general population of Chicago, in the United States, across the globe. If you think about refugees potentially fleeing from their countries. So our hope is that Dr. Bridges-Carter will share her expertise and research about the issues that arise from this type of trauma, the systemic issues that might be causing it, and how we can prevent and cope with this type of trauma. Should anybody in the audience experience difficulties during our program, we have several counselors in the house, and if you're a counselor from the counseling department in the house, I might ask you just to raise your hand just so we can maybe identify you. I know we have one, we have a couple of other people. They're most likely outside. So we have a counseling table outside, as well as representatives from the Multicultural Student Affairs Office, so please don't hesitate to see them. For those affected by racial and ethnic trauma, there's going to be a follow-up group discussion on Monday, April 24th at 2 o'clock in S216B. There's a sign-in sheet for that as well, a week from Monday. And I believe Shania might have some flyers for that as well. Our presenter today is Dr. Shenay Bridges-Carter. She graduated from the University of Illinois Urbana-Champaign and Hampton University and obtained her doctoral degree in counseling psychology from Pennsylvania State University. She is a licensed clinical psychologist, and her clinical areas of expertise are depression, trauma, identity-related concerns, and relationship concerns. Her research interests include stereotype threat, implicit bias, racial battle fatigue, and how these impact the experiences of people of color. She's the Director of Clinical Services of Counseling and Psychological Services at Northwestern University's Evanston campus and has worked in the college student mental health for 18 years in various capacities and at various types of institutions. She's also a senior adjunct professor at the Chicago School of Professional Psychology and the founder of her own private practice, which she's had for over 10 years. Everyone, please join me in giving a warm welcome to Dr. Shenay Bridges-Carter.
Thank you so much, Nick. Good morning, everyone. I said good morning. It's like 80 degrees outside and y'all in here, so I must be special. Thank you. I know we don't get a lot of these in April, so I am super excited to be here with you all this morning, and I really hope that we can have a good discussion. This is a topic that not only do I feel passionately about, but I feel like it's something that everyone probably has an experience or something that they can contribute to the conversation. So I really look forward to speaking with you all this morning and talking a little bit later when we have our Q&A session. So welcome. So first thing I like to talk about is what is trauma? I think a lot of folks have a very specific idea in their mind of what a trauma experience is, right? What a trauma experience looks like. And I'm here to tell you that it's much broader than probably what you think it might be, right? For the purposes of our discussion today, we are going to be looking at the emotional and mental experience of trauma. So we're not talking about necessarily like combat or folks who have been in accidents. We're looking at emotional and mental experiences of trauma. So many of the terms that we are looking at can be interpreted in different ways, right? So is it painful? Is it fear? Is it dissociation? Are you confused? So these are very subjective terms. So please make sure that you're just thinking about this from your own subjective experience or from any individual's subjective experience of fear or helplessness or confusion, okay? So there's no specific threshold. It's just your own subjective experience of these things. Oh, I got a clicker. Sorry. Okay, so the brain. So I'm not going to get too into the brain functions of trauma because I don't want to put y'all to sleep. It's already hot in here, right? I really want to just focus on three specific areas of the brain, okay? That's the prefrontal cortex, the amygdala, and the hippocampus. These are the areas of the brain that really get impacted by trauma experiences, okay? Some of them shrink, some of them start going into overdrive, and really what happens is that these parts of the brain get impacted in multiple ways, okay? And these areas of the brain, they impact our response to stress, they impact our memory, like what we recall, and they impact whether or not we feel like we're kind of present in the moment, or do we start to kind of dissociate and kind of go to our happy place, right? What's important to remember for the purposes of this presentation is that these impacts that trauma has on the brain can have long-lasting effects. So what that means is, like, some traumas are just kind of isolated incidents, but some traumas are ongoing, right? They happen maybe not daily, but maybe just on a consistent basis. It's more chronic. And so when you have experiences that are happening on a consistent or semi-consistent basis, the brain starts to change how it responds to fear, how it responds to other stimuli that happen in your life. And so the experience that a person has when they've had a trauma experience can then impact how they respond to future situations. And those future situations don't even have to be traumatic in nature because the brain is responding to a perceived trauma or a perceived trigger. And whether or not that trigger is actually happening or not, the brain doesn't have time to kind of figure that out, right? It's kind of like, we're going to respond first and figure out what happened later. So I want you all to just be aware of the impact that trauma has on the brain, because this is something that can impact a person throughout their lives, okay? Next is the body. So we talked a little bit about the brain, but I really want to talk about the body. So how does the body keep score, right? So you can see in our little gingerbread man here, we have a lot of different ways that trauma can impact folks, right? Headaches, physiological arousal, that's like your heart rate increasing, right? Chronic pain, digestive issues. How many folks here know people who are always having some sort of stomach pain, irritable bowel syndrome, those types of things? All of those can be connected to stress and connected to trauma, right? And so it's really easy for folks to feel overwhelmed. They feel like they're on edge. Muscle tension, like they just feel like they can't relax, trouble sleeping, tightness in the chest, brain fog, memory issues, not to mention depression and anxiety, right? So the body is keeping score of all of these different types of feelings and reactions that happen to us when we experience a trauma, okay? Next we have here behavior, right? So this is kind of the behaviors above the iceberg on top there. Those are the behaviors that we see, right? We see somebody maybe sabotaging themselves, right? Engaging in self-sabotaging behaviors. Maybe they are acting out sexually. Maybe they are engaging in self-harm. Maybe they're running away. They won't stay home. They're running away, or they're lying a lot, or they're stealing, maybe engaging in some criminal type behaviors, right? But what is beneath the surface? What's beneath the surface is folks feeling unsafe, right? Folks feeling afraid, folks feeling shame, guilt, rejection, alone, worthlessness. So this is what's actually happening to a person versus the behaviors that we see. So trauma impacts how a person behaves. Again, going back to the brain conversation, it's because the brain is responding to a perceived trauma or a perceived threat that's happening, okay? So those end up definitely impacting our behavior and how we see folks engage with others. Last, we have here how trauma impacts emotions. Now, I know I don't have my glasses on, so I probably wouldn't be able to read that if I were you all, but it has a lot of different ways that trauma impacts how a person feels, their feelings, right? The loss of safety, loss of danger cues. So how am I able to determine what's a dangerous situation versus a safe situation, right? A person's yardstick to kind of be able to make those determinations can get put off a bit, okay? Loss of trust. They no longer trust certain environments, maybe certain people. Maybe they don't even trust themselves anymore, okay? So a loss of trust. Feelings of shame, right? Like how did this happen to me? How did I allow myself to be in a position to where something like this happened to me? Loss of intimacy, right? Folks don't necessarily feel like they want to be intimate with others. They don't want to feel vulnerable. They don't want to be vulnerable with other people. So there's a loss of intimacy, and that often has impacts on folks' relationships, okay? Dissociation, again, this is the person going to their happy place, right? They feel like they have to go mentally somewhere that's not present because being in the present does not feel safe. Loss of physical connection to body. How many folks have ever heard someone say, I just don't feel connected to my body? Like they just feel like they're going through the motions. So it's like, especially if you think about a trauma where maybe someone was physically abused or physically assaulted, there may be an aspect of that assault that they just lose connection with that part of their body. They just don't feel connected to it anymore. Loss of sense of self, right? People don't recognize themselves. They don't feel the same way that they used to feel. And so the person that they used to be, right, maybe very outgoing, maybe very gregarious, they now isolate themselves, right? They now might be very introverted and not engage with people that in the ways that they once did, okay? Loss of self-worth. So a lot of people, they internalize what happened with them in their trauma, and they blame themselves, or they feel like they've lost their own sense of self-worth because of what happened to them. And last is reenactment. So this is really kind of recreating some of the same dynamics that existed when they experienced the trauma in the first place. This can happen when folks really intentionally sabotage relationships, or they sabotage situations, workplace situations, let's say situations socially with friends. They create a dynamic that will reestablish the same characteristics that existed when they had the trauma. Okay, so this is how trauma can impact our emotions. And one thing I just want to point out before I move on to the next slide is that trauma can be almost anything, right? I mentioned earlier that folks have a very specific idea in their minds of what a trauma is and what a trauma isn't. And very few people would probably raise their hands to say, I experience a trauma daily. But what do you think happens if a person is in an environment where there's constantly chaos, there's constantly violence, there's constantly a lack of safety? That is trauma. Just because it happens to you every day doesn't mean it's not trauma. Because our brains, our bodies, our emotions were not created to withhold that type of consistent trauma. And so it's important to me that you all understand this, because sometimes people, they have reactions to things, or something happens to them and they respond in a way that feels off to them. And they don't understand why they're having the reactions that they're having. And sometimes the reason is because that is a trauma response. But until you recognize your experience as being that of a trauma, you will not be able to accurately kind of assess what's going on for you. So I just want to emphasize that, because a lot of times people, they only have a very specific idea in their mind of what trauma is. And I want folks to broaden that horizon. And now we get to the idea of racial and ethnic trauma. And this is a distinct form of trauma. Hopefully, soon it will become a part of the DSM. The DSM is that diagnostic statistical manual that mental health folks use to give folks mental health diagnoses, right? If anyone's ever been to therapy, you may have received a diagnosis, right? So hopefully it will soon be in the DSM. Reason that that's important is because it adds credibility. It adds credibility to folks' experiences, okay? People who have gone through it, they've been known that it's a thing, right? But it's the fact that we have to convince others that it's a thing. So racial and ethnic trauma. So this refers to the mental and emotional injury that has been caused by encounters with racial bias and ethnic discrimination, racism, and hate crimes. Any individual that has experienced an emotionally painful, sudden, and uncontrollable racist encounter is at risk of suffering from a race-based traumatic stress injury. In the United States, BIPOC, which stands for Black, Indigenous, People of Color, are the most vulnerable people to this racial and ethnic trauma. I have a quick video clip for you all that I'd like to play. It's a little over 4 minutes. So I know folks' attention spans sometimes are short with videos due to TikTok and everything. But 4 minutes, I hope we can get through it, all right?
Black Lives Matter. Racial trauma isn't just something that Black and Brown Americans experience regularly. It's something health experts say they're born into.
What makes it traumatic is how you experience it.
Similar to PTSD, racial trauma, or race-based traumatic stress, is the collective effect racism has on an individual's mental and physical health. It can be from major experiences like workplace discrimination or hate crimes, or it can be the result of an accumulation of many small indignities called microaggressions, or system or institutions that enforce structural oppression.
There was a national survey done by the American Psychological Association, and about 25% of all African Americans, 30% of all Native Americans report at least one of those experiences at least once a week.
The APA says not only do Black, Indigenous, Latinx, and Asian American people significantly suffer from racial trauma, but that it can also compound with additional oppression based on gender or sexual orientation.
It depends on the intensity and the frequency of how often you experience racism or how severe the event is. But you might start with just race-based stress. So something will be racist and you'll be exposed to it and you'll feel stress. But racial trauma is really when it has those long-term effects. It really sticks with you.
Immediate symptoms can include increased heart rate or blood pressure, heightened cortisol levels, sweating, or tension in the body. Long-term chronic exhaustion and fatigue are among the most common symptoms.
Just sadness, underlying or overt anger, even thinking differently about yourself. So sometimes believing or starting to endorse those stereotypes that people might have about your racial group. If you're experiencing racial trauma, you might have some of that internalized racism.
Increased hypervigilance, the having the nightmares or flashbacks, avoidance of situations where they may, perceive it as threatening. All of those are consistent with what we find in race-related stress and PTSD. And so there's a lot of overlap.
Kind of, bouncing back and forth between that and none, and never really feeling safe and socially connected and supported. And that also affects your brain and how your brain develops.
America's healthcare system impacts racial trauma too, making it more difficult not only to find help, but someone who understands a patient's experience. A 2015 study found that in the US, 86% of psychologists were white, 5% were Asian, 5% were Hispanic, 4% were Black. Meanwhile, some of the experts we spoke to are setting out to help. Dr. Candace Nicole Hargens released Black Lives Matter meditations for racial trauma victims and white allies.
Black lives matter.
Therapist Kelly Baker has helped organize Facebook Live videos with her local NAACP branch where anyone can connect to learn more about racial trauma. She's included sharing her own experiences.
I don't think you can say that there was ever a time for me when I did not, that I was never exposed to racism. When I think about my family, my mom, my grandmother, and the things that my mother experienced that were clearly racist definitely affected how she parented her children.
What can be done to respond to racial trauma? Dr. Erlanger Turner tells Newsy adding an official diagnosis of racial trauma to the DSM-5, an encyclopedia of sorts for mental health professionals, is not the solution. He suggests racial trauma's existence is something everyone should be aware of, especially healthcare providers and policymakers.
If you are white, you do need to make sure that you try to understand that person's experience, that you provide some sense of solidarity, that you don't apologize. I think people oftentimes want to apologize in these situations, and that's really not helpful. We need solutions, and so I think that is one of those things that we have to do better and make sure that we take ownership.
Lindsay Thies, Newsy, Denver.
So I would like to talk a little bit just about the history of racial trauma. And trust me, we could talk about this for weeks. So I am going to keep it brief. But I just want to point out that there are differences in the ways that folks experience trauma over the past few decades, right? And this is just like, quote unquote, regular trauma, right? PTSD trauma, the level to which folks are given that diagnosis, okay? And this typically results in people of color receiving higher rates of PTSD. Now, we could come up with, I'm sure, many reasons why this might be the case. But a part of what contributes to that is racial trauma, okay? Experiences with racial discrimination are one reason for the increase in these experiences of trauma. Additionally, these experiences go back for generations, right? Generations folks have been having these experiences. But it's only within the past, I might say, 5 to 8 years that folks have started really talking about this as a specific, unique experience of trauma. Experiences of harassment by law enforcement, exclusion from access to resources and other important opportunities, mistreatment in schools, mistreatment at work, and traumatic experiences related to interpersonal discrimination, microaggressions, as well as pervasive institutional discrimination and a hostile national context. Now, what do I mean by hostile national context? It means the incidents that happen wherever you are, in this case, the United States, that create a hostile environment for specific ethnic or racial groups. And as you all know, these experiences, they ebb and they flow, but they never go away. So some of the symptoms of racial trauma. So we have symptoms that, similar to the trauma we just discussed, tend to be psychological, biological, and social. For psychological, we're talking about anxiety, of course, depression, irritability, hostility, avoidant behavior. Avoidant behavior can look very different from person to person, but it can be avoiding situations or people that remind them of the stressor. If the stressor happens at school, and the stressor happens at work, and the stressor happens in your neighborhood, how do you avoid those things? It's going to be a problem, right? So if you don't avoid them, then that means you go into them with a certain level of anxiety, a certain level of fear, hypervigilance, okay? For biological symptoms, we're talking about cardiovascular disease, increased risk of stroke, lower birth weight, high blood pressure, and even higher rates of asthma. If these symptoms sound similar to some of the risk factors, health risk factors for people of color, that's why, right? There's a congruency here, right? These are similar experiences, okay? The social symptoms, a person might feel trapped, right? I just talked about if it's at home, if it's at work, if it's at school, where do you go to get away from it? There's a feeling of being trapped. Absenteeism, I don't feel like dealing with it today. I'm not going, right? So people, they don't go to school, or they start skipping classes, or they don't go to work, or whatever environment the stress and the trauma exists. Okay? Substance use. They start self-medicating, right? It's like, I can't deal with this. So I need something to help me escape mentally from these feelings. And folks use alcohol, folks use drugs as a way to self-medicate with trauma all of the time. There's a super high correlation with folks that have PTSD diagnosis and substance abuse diagnosis. Very high correlation there, okay? So I think it's important that we understand, in addition to all of these different symptoms, if you take any one of these in isolation, bells might not be going off in folks' head to say, hey, this is a trauma reaction, this is a trauma response. So we have to be able to connect the dots to get folks to see that this is a reaction to trauma. And sometimes you have to connect the dots for the person having the symptoms. Again, because they might not be recognizing their experiences as those of trauma. The impact of racial trauma. So folks, again, might avoid situations that are reminders of past racial experiences. This can include, again, we talked about school, work, friends, doctors, dentists. Any sort of experience where one feels like they have been treated differently because of their race. Again, this is about their perception, okay? So if folks distrust these individuals due to past losses or past letdowns, and examples are law enforcement, healthcare workers, then this puts them at a distinct disadvantage socially, medically, because they are less likely to engage with these individuals even when it could be helpful. Even when it could be helpful. There's also a lack of representation in certain spaces. People don't want to be a part of decisions with the government because they don't trust the government. People don't want to be a part of research with medicine because they don't trust the doctors. People don't want to be a part of research that has anything to do with consumer products because they don't trust that their best interests and their values are going to be kept in mind, or held in high esteem. And as a result, we have less information about the medical histories, about what would be best for marginalized folks or folks of color because of the distrust and mistrust of those institutions. And there is a direct impact. These things are very cyclical, okay? So there's a mistrust or very minimal engagement with multiple institutions, and it affects the health, both mentally and physically, emotionally, of individuals of color. Race-based traumatic stress, RBTS, okay? So this is a unique psychological and emotional distress. It's kind of the term that has been coined that explains these types of distress, right? And these experiences can occur on a macro, meso, and micro level. So folks, I'm sure have heard the term microaggressions, right? So microaggressions, those, we're going to start kind of in the inside, in the inner circle. Microaggressions are an individual interaction that a person has that has racism, sexism, heterosexism, nationalism embedded in the interaction, right? And I put some examples here, such as assuming a person is an alien in their own land, right? So surely you're not an American, you must be from somewhere else, right? Or we have an assumption of inferiority. Well, how did you get the position that you have? How did you get to be where you are? Or this person can't be the doctor. Those types of microaggressions. Then we have the meso-level aggressions. Okay? These can be race-based traumas that are on a scale of a specific contained community. So examples are like the prolonged water crisis in Flint, Michigan, right? Or immigration harassment that occurs in some specific states. Those are meso-level aggressions. Then we have macroaggressions, okay? These are society-level events and policies that are racist. Examples are over-policing in communities of color, September 11th and the impact on the Muslim community, COVID-19 and the increase in Asian hate crimes. These are examples of macroaggressions. Now, I want to talk about vicarious trauma, direct trauma, and systemic racism, because these are all very important concepts to understand. So vicarious trauma says that you don't have to have experienced the trauma directly in order for you to be impacted by it. How many folks here have seen somebody get shot on a video? Bam. Right? All of the emotional residue from exposure to traumatic stories and experiences. You see folks crying, you see folks being killed, you see folks being maimed. These do not go without an impact on us. This is a vicarious trauma. And so if you feel like, well, I've never experienced anything myself directly, but I still have these reactions, these responses when I see it, that's because you're not supposed to be seeing that type of stuff. It's supposed to have an impact on you. It's having an impact on you because you're a human being, and it's supposed to have an impact on you. Vicarious trauma. Then we have types of direct trauma. So direct trauma is, a person who either directly experiences the trauma for themselves, or they are like a first eye witness, right? An eyewitness to the trauma. And we have here acute, chronic, and complex trauma. Acute is the trauma that is the isolated event trauma, right? It's something that maybe happens one time, okay? Or it could be a traumatic event that is just very isolated in your mind. The time when the house caught on fire. The time when I got robbed or something like that, right? An acute trauma. Chronic trauma results from exposure to varied and multiple types of traumatic experiences. These usually occur within interpersonal relationships. So examples of these might be neglect, regular physical abuse, regular sexual abuse, so something that is ongoing in a specific area of your life. Complex trauma. This is when you just got the hits coming from all sides, right? These are multiple traumatic or prolonged events. So long-term abuse, domestic violence, living in civil unrest. Complex trauma is when you don't just have one area of your life that's chaotic and traumatic, but you can't find peace anywhere, okay? And then we have systemic racism. And the little offshoots here of systemic racism include interpersonal racism, individual racism, institutionalized racism, structural racism, and institutionalized racism. I think I maybe said that twice, sorry. Internalized racism, internalized racism. So these are the areas where it involves whole systems. It involves politics. It involves the legal system, the economic system, the medical system, the criminal justice system. All of these systems are upholding these structural racist policies, okay? We also have institutional racism, which can be interchangeable with systemic racism, but institutional is kind of like at the institution level, right? So you might say a university is an institution, and as an institution, that place holds up racist policies. They hold them up. But structural is at the government level, so the policies that all of the universities adhere to, okay? And the individual instances of racism are those experiences that you have as a person, that you have one-on-one with people, or even with a group, but it's your individual experience. And the internalized racism, as was discussed in the video we watched, is when people start to internalize those messages, and they start to feel that they are less worthy. They start to feel that they deserve the type of treatment, or if not themselves, that members of their group deserve that type of treatment, okay? Next, we have intergenerational or epigenetic trauma. This is my fave. Okay, so I want you all to, if you get a chance, of course I'm a research nerd, but this is a study with mice and cherry blossoms. So what happened is, in the first generation of mice, you all are familiar, I'm sure, with like classical conditioning, Pavlov's dogs, all of those things, right? So in the first study, they paired the smell of a cherry blossom with a shock for the mice, right? And the mice learned quick, once I smell that cherry blossom, I'm about to get shocked. So I am, as you can see, the little mouse freaking out over there, right? He's freaking out. Freaking out. Like, don't shock me. So now whenever they smell the cherry blossom, separate of the shock, they feel that shock is coming. So they have successfully conditioned the mice to have a fearful reaction to the smell of a cherry blossom. Now this is the mice's kid. The mouse's kid, they don't have that experience of the association between the cherry blossom and the shock. But guess what? When they smell that cherry blossom, they're still freaking out. Now the original mouse's grandchild, grandson, granddaughter, they still have that same response to the smell of the cherry blossom. And I want you all to think about for a moment what the implications of this are for the experiences of trauma. That mouse freaking out, that's a trauma response. So the first mouse might have the memory, right? I'm personalizing these mice, right? The first mouse has they remember, they're like, you know what, I remember when they shocked me with that cherry blossom, and that's why to this day, I am afraid of the smell of a cherry blossom. I can't take it. Every time spring hits, I'm out of here, right? I'm freaking out. But the mouse's kid, they don't have that memory because they were never directly impacted by that trauma. But guess what? They still have the same response. So that means when spring hits, they too are freaking out, but they don't know why. All they know is every spring, something ain't right. Now the mom might be like, you know what? Let me tell you what happened though. I freak out too, and this is why I freak out. And so there might be that word of mouth message that gets passed down, right? But imagine you go generations and generations. At some point, the fact that grandma got shocked with a cherry blossom is going to go out of folks' memory. But the generations still freak out with the cherry blossom. So you're having a trauma response and you don't even recognize the trigger. You don't know. So what does that mean for your ability to control it? What does that mean for your ability to recognize the symptoms or the preceding factors that impact your freak out? You don't know, you just out here freaking out in the spring. And you don't know. I think this is so interesting because the ability to, in your mind, connect the dots of a trauma experience and a trauma response are vital to your ability to get treatment and to understand that you even need treatment. If you don't recognize the trigger, then you have no idea about the response. So that leads to just the idea of intergenerational, multi-generational, and transgenerational transmission of trauma. Out of our entire DNA, like the pie chart, right? Just 2% of our DNA accounts for our physical traits. Your nose, your eyes, your ears, right? 98% of our DNA is considered non-coding DNA, and it's responsible for the emotional, behavioral, and personality traits that we inherit, and it can be impacted by environmental influences. So we can certainly pass this down. So, I am getting to the idea of how do we cope with this? Because we could talk about intergenerational trauma like all day, literally. But it sounds kind of hopeless when I'm talking about like, dang, well, what do we do? Like, we just out here just like struggling. And we don't even know we're struggling half the time, right? So if you feel like you're having responses, that's why the communication and the relationship between families and parents and grandparents and ancestors can be so important. You can learn about what your family has experienced. And you can recognize, hopefully, if you feel like there are some similarities that you have. So when it comes to how can we possibly look to take care of ourselves, to cope with this racial trauma, to be honest with you, the answers aren't very different from typical, so to speak, trauma, but it does include a very specific part that other traumas that are not race-based traumas don't include. So self-care, obviously, you have got to understand and know yourself, know when you're reaching your breaking point, know when you need to take a break. Say, time out, I need a mental health day. I need a break. Okay? And whoever gonna be mad, they can be mad. I say mad is one way that you are totally allowed to feel. It's one of many options, okay? Connect with your community. Connect with the people who help you feel restored, the people who give you energy, the people who can connect with you on your experiences and be like, yep, I know exactly, we ain't even got to talk about it because we already know. What's understood doesn't need to be talked about. We ain't even got to do that, right? Connect with your community. And that helps to, one, reassure you that you're not crazy. Your experience is valid. Your experience is real. So please connect with your community as long as they are supportive of you and they are wanting to help elevate you. Don't connect with folks, don't connect with your haters, right? No. We connect with the people in our community that are positive folks for us to connect with. Mindfulness and spirituality, and this might include specific religious practices for some folks, right? But that ability to kind of go within and connect with something bigger than you, something above you, that can help you to get peace, help you to feel restored, help you to just silence the noise and focus on you. Limit your exposure to news and social media. And trust me, I get it. Our phones are like an extra appendage, like I get it. And it can be very difficult to avoid news and social media. But from time to time, if you need to do that for yourself, that's a part of self-care. Please do that. Take a hiatus. News now is constant. Look, I was born in the 80s. I'm going to date myself. I was born in the 80s when news used to come on at a specific time. Like that was the time during the day when you got the news. Now it's 24/7. Holidays, news don't take a break, right? But you need a break. Your brain needs a break, okay? Activism and advocacy. Some people are like, you know what? I don't get restored by sitting here and relaxing. I need to get out there in the streets and let it be known that this is not right. And that helps bring energy to folks. And we need those people. We need someone to get out there and to let folks know what's happening is not right and that they are going to fight against it. And so for you, if that helps you to feel better, that gives you energy, do that. I got some Sharpies you can write on all of the poster boards. Okay? Get out there, write to folks, send emails, make TikToks, whatever helps you to get the word out about what you feel passionate about. Advocate for yourself, advocate for what's right, advocate for your community. And explore the benefits of, I have trauma-informed therapy, right? Obviously, as a psychologist, I'm biased to think that therapy is extremely helpful in many cases, right? And so you're going to hear that from me. I would be remiss if I didn't mention it. But please make sure that you understand that every therapist is not the same. You might try a therapist and be like, I'm not connecting with this person at all. That doesn't mean therapy doesn't work. That means that person didn't work for you. You have to find someone that's a good fit that you connect with. Now, that doesn't mean that the person has to have all of your same identities. That doesn't mean that. But it might mean that they need to share a couple that are particularly important to you, that you feel helps to create a connection. Okay? And these are a handful of ideas and suggestions, but there are many more. I'm sure you all probably have some excellent ideas that we could discuss too. And that is the end of my talk this morning. Thank you.
I appreciate it. Dr. Bridges-Carter, thank you so much for sharing your expertise with us. I think all of us have a much better, a much wider perspective of the topic. We're going to open up the forum for Q&A, and how we're going to do our Q&A is I would like to ask you to take a look to see if there's a blank note card sitting near you. on your seat, on the arm of your seat, and can you pass it to somebody who wants to write down a question?
All right, the question I have is, in many BIPOC and immigrant families, mental health and therapy is a taboo subject. How can we talk about these types of traumas without setting off a minefield?
That's a really good question. I think it becomes important in these situations to identify who are the safe folks in your family or in your close-knit community that you feel you could talk to. And that might not be everyone. And it might not be the people that you really wish that you could talk to about it. Sometimes something that can help to ease the conversation is you might ask maybe a family member, have they ever felt X? Have you ever felt Y? Just not during a high stress time, but just, a casual conversation to see if they can start to open up about, you know what, I have felt like this before. And then that might be an opening into having a conversation. So I think, I would never tell anyone to talk about mental health or trauma experiences with someone that they don't feel it would be safe for them to talk to it about. Please don't do that, because that's just going to create more of an obstacle for you. So find the folks that you feel safe with, and if there's someone that you really feel like it would be so helpful to me if I could talk about this with this person, try to find a way to ease the conversation and start with talking about them. Because typically, folks are more comfortable easing into it that way, and then that's a way that you can connect with them on an emotional experience, a shared emotional experience. I hope that helps.
We have a question over here too. That's, what can people, you kind of addressed it a little bit, but what can people do when certain others don't believe racial trauma exists?
Yeah. And I feel like we're on Family Feud. Good answer, good answer. So I would say that the excellent news is that it's not your job to convince them that it does. Right? This is your experience, right? No one can go in your mind and in your body and tell you how you feel. People who are open to having the conversation, people who are open to hearing your experience, those are the people that it is probably helpful to engage with. And a person doesn't, typically people who don't believe it's a thing haven't had the experience. And so it becomes a situation where I'm trying to convince you that how I feel is valid. And that's not a good way for me to spend my energy. It's not a good way for me to spend my time. So I would say, folks who don't think it's a thing, let them continue to think that. And you can talk to them if they're open about your experience. But if you feel like that is an unsafe situation or a situation where you are being made to feel that you're doubting yourself or doubting your truth, then please, you can exit stage left. Or they can.
Thank you.
Yeah.
I have a couple of questions that are kind of headed in the same direction. Mm-hmm. So the changes in the brain that happen due to trauma, with therapy, do those reverse, those change? And is the response of the brain that happens with trauma like an evolutionary process that goes AWOL, or is it, how would you explain that?
Yes, I'm going to answer the second part first. So I think that what happens with the brain is your body responding to a stimulus, right? So I think it definitely is kind of an evolutionary thing that didn't know when to stop, right? But to be fair, I think there are also many different aspects of an environment that can create cues of danger for folks. Right? So if you think about, I think this is like a classic example, someone who maybe saw combat, right? and they come back, and it's like the 4th of July, right? And there's all of these fireworks, and they start freaking out, right? Then this kind of almost like a flashback can be at times because of the startle of that noise, right? And folks might be like, what is going on with them? Like somebody, and you feel that way because you are aware of the context of the fireworks, right? Of the context of it's the 4th of July, all of these things. But to be honest, it's not a bad thing to be fearful with loud, unexpected noises, right? So your brain is doing what it's supposed to do. It's just that the context in which it's doing it in, it hasn't been able to filter that out because it was really being kind of like overutilized. It got over kind of stimulated to the point where now it's like, I'm gonna ask first and ask questions later. So it definitely, I think, is an evolutionary process, and I like that phrase to describe it. I'm sorry, in the other part?
It was about healing. Does
Oh,
the brain
healing,
heal?
yes, absolutely. You know, there is probably a lot of debate on this because there are a lot of different types of therapies that exist to address trauma. There are some that are kind of like talk therapy where folks are talking about things, but there are some that are more physical in nature, such as EMDR. That stands for eye movement desensitization and reprocessing. And research has shown that there are actual changes that occur in the brain when one has gone through EMDR therapy. And EMDR is a therapy specifically created to address the effects of trauma. There are also neurofeedback, in which neurofeedback actually put patches on folks' head to kind of measure how their brain is responding to certain stimulus. And it tries to kind of through like practice, get your brain to respond in ways that the brain would have responded to pre-traumatic experience. So there are some that specifically look at the brain functioning. So I would say the answer is yes, sometimes. But it really depends on the type of therapy and if they are actually looking at the brain both pre and post therapy to see the differences.
Hey, I have a question. Someone wrote, as a white male, I will never relate to racial trauma. How can I be an ally to help the BIPOC community?
It's a really good question. The thing about being an ally is that it's not a label that one can give oneself, right? I can't just like wake up and say, like, oh, I'm an ally for this group. And they're like, oh, are you? Right? So it becomes something that you have to engage with the community that you want to be an ally to in order to find out ways that you can be supportive, ways that you can be encouraging without stealing their voice. Right? So I would say, please engage with the community that you want to support and learn from them what types of behaviors and what types of supports would feel in allyship with them. Does that make sense?
Yeah, thank you for that. I'm going to try to lump a few different questions here, kind of off that same vein.
Sure.
And if you come from a, kind of worded it here, it's if you come from a family of haters, there
are some out there.
like how can you maybe encourage your family or the people that you trust to seek help or to help to be receptive to this idea, even though they don't want to listen?
Yeah. So, and just for clarity, are we talking about help for the family or help for the individual? And they're trying to talk to their family about it.
I think it's both. I'm trying to combine three different questions. So if you address it from both angles, we'll hit
We'll
them.
just, we'll do a twofer. Okay.
Yeah, perfect.
So I think in terms of help for the family, people don't respond very well to you coming up to them and saying, you have a problem, right? Like, you know this is an issue. You know you're doing this wrong, right? This being a parent thing, like you've got it all, messed up. So what typically helps is people feeling an authentic level of concern. Like I actually am concerned about either an aspect of your relationship or something that you see them doing that you feel like you just have genuine worry about, like a genuine concern. And to say, can we talk about this? Because I'm worried about this, and I want to see this improve. I want to see our relationship improve. I want to see us connect more. So coming from a place of wanting to connect as opposed to a place of admonishing that person for not doing things right. So when you come from, that helps to lower folks' defense mechanisms, right? Because people get defensive. Imagine somebody just came up to you and told you something you had been doing for 20, 30 years was wrong. You might get defensive too. So I think it's really about coming at it from a perspective of authentic care and concern for the person, and trying that as an opening to having an honest discussion about what you all can do. And sometimes, and I've had people do this, they have come to the first therapy session with their family member or with their friend as a way to help make them feel more comfortable and show them that it's not as scary as you think it's going to be. Now, that obviously has to be something that, everyone involved, therapists included, are open to, but it might be a way to kind of help alleviate some of that fear, or at least the person feels like they have someone with them, right? Not just an ally, but an accomplice, right? To help them along the journey.
Thank you.
Yeah.
Okay, I have a question that says, since there are very small percentages of Hispanic and people of color who are therapists, what can be done to get more people of color to become therapists?
Y'all gotta go to school. Be here. Right? I know I am a huge proponent of, one, understanding that folks who are helpers and who are healers can come from anywhere. Right? So I'm certainly not gatekeeping, and those percentages that were given in that video are of psychologists, right? So I just want to point out that there's a very specific group. It doesn't necessarily represent the same percentages of licensed clinical social workers or licensed clinical professional counselors. So there might be differences there. But to be sure, folks of color are underrepresented in all of those areas. So certainly us opening up and making education so folks can get licensed and folks can get credentialed, us kind of not gatekeeping that so much and really making it more accessible for folks. And I think also not being afraid to talk about your experience if you've ever been to therapy. Because it is so hush-hush, and it's confidential for a reason. And trust me, I am a fan of confidentiality. But if folks just had the courage to say, I've been to therapy, or I'm in therapy, and it's been awesome for me, even that could help to break down some of the barriers and obstacles in some of these communities. So folks felt, one, more able to take advantage of the resource, and two, they felt like it's a career option for them that would help them to help their communities. If I didn't see people of color in my practice, I wouldn't be a therapist because I wouldn't want to do it. It is very important to me to be able to help the communities of color where I'm at. And that is a part of what drives me.
I have a question that says, what can professors do in the classroom to provide a racially trauma-informed learning environment?
One, I really think that the experience of a student in a classroom can vary significantly from person to person, even within the same classroom, right? But one thing that professors can do, I think, is be open to talking with their students about how they're doing and creating flexibility when possible for students who might be having a difficult time. And I say this being an adjunct professor. I've been teaching for over 10 years. And trust me, I understand that it can be inconvenient to have to give an extension for this and an extension for that. And I feel like to try to be reasonable with folks, because understanding that the students are human as well. And if there are situations that happen in your classroom where maybe a discussion goes off the rails or things go left, to try and address that, right? Don't let just people get run over and offended in your class without any sort of intervention. You at least want to be like, okay, let's back this up for a second. This conversation doesn't seem to be going in a productive way. So let's time out and have a conversation about what happened. And I think there has to be a bit of facilitation skills that professors should have because, like it or not, the classroom is a group experience. So I think that would be something that could be helpful.
I have one other question here. That's, what if the person's experiencing the trauma from people they trust and it's a constant threat? What kind of tools insight could you give this person to maybe address this with those that they trust?
So the people that they trust are the people who are traumatizing them?
Yeah.
Don't trust them.
Okay.
Right? I mean,
Agreed.
I know it sounds simplistic, but those are folks that you shouldn't trust.
So if it's our family, what would you recommend?
Absolutely. If your parent is someone who is toxic in your life and is traumatizing you, just the fact that they birthed you does not give them access to traumatize you for the rest of their lives. It just doesn't. And I know that's hard in communities of color. Trust me, I get that that's a hard pill to swallow. So you might not just be able to cut people off cold turkey, but try to limit your exposure. Limit what you tell them. Limit the ammo, so to speak, that you give them to continue to traumatize you.
Thank you for that strengthful insight.
Yeah.
My question is about somebody who's a caregiver of somebody with PTSD, and they want to know what the impact is called when someone else's trauma is influencing you.
That vicarious trauma, it's probably the vicarious trauma. Like you either helping them manage their trauma or you witnessing them work through their trauma, and it's having an impact on you. So a lot of times they talk about vicarious trauma in the capacity of mental health workers who are dealing with folks that have trauma, right? You talking with them about their trauma, you helping them heal from their trauma can create vicarious trauma for you. Law enforcement, they have vicarious trauma too. Anyone who is witnessing the trauma of another person or is witnessing that person respond to that trauma is experiencing vicarious trauma. And that's a valid thing for you to seek assistance for.
I think we addressed this a little bit, but from the perspective of finding yourself, someone wrote, how do you work to find yourself after identifying you have race-based trauma? Sometimes you discover that a lot of your behaviors are a result of race-based trauma. What do you recommend to help clear the clutter and find yourself?
So one thing I think that almost kind of immersing oneself in the information about race-based trauma can be helpful because it gives you the terminology needed to describe your experience. A lot of times people have experiences and they know something feels off about it, but they don't know what it is, they don't know what to call it, they don't know how to get help for it. And so being able to find the language to describe your experiences usually helps someone say, like, that's what's happening to me. This is my experience. And then that can lead them to more information that tells them how to get help for it. I think when we don't recognize our experiences for what they are, it makes it more difficult because we're just like grasping at straws, trying to figure out what's wrong. Also looking into ethnic and racial identity models, right? To see where do we fit on this spectrum and where did I come from, right? And there are tons of documentaries, tons of books, and ways that folks can go about educating themselves and looking at others' experiences, because it can help you to be able to verbalize and articulate the dynamics of your own experience.
Thank you. Try to combine a couple here also, but like as far as like from a governmental or public policy standpoint, are there ways that are there policies that could be implemented to help advocate healing for trauma, or even educating, with police reform? Okay.
No, I smile because I'm like, now that's a job right there, right? I mean, I think all of these things are possible. If I didn't, I would be in the wrong profession, right? I think all of these things are possible. I think that it's hard to do it on your own. I think it's where kind of like community organizing and getting connected to folks who are like-minded in that way of wanting to push forward these policies and bring the awareness, right, to the importance of mental health treatment, access to mental health treatment for folks. That's one thing that I think the pandemic just ripped the tablecloth off the table, so to speak, was about access, the importance of access to mental health treatment. And so being able to be in the spaces where you can have the conversations with people who have power, that is the difficult part, is being able to be in those spaces. So I think that's why community organizing and connecting with folks who have access to those individuals is vital when trying to push forward policies of equity and equality.
So just opening up for mental health, more access is
Absolutely,
kind of the primary
absolutely,
policy that should be
absolutely.
made. Okay.
And for police reform, now that is a hard nut to crack. But I do think it can be done. I think we have to find empathic folks who recognize the problem.
Maybe we found our topic for next year. Yeah. For the sake of our time, that's going to conclude the presentation, everybody.
Thank you so much.
Let's give Dr. Shenay a thank you again for an amazing presentation. Thank you all for coming.